afternoon, everybody. Thank you so much for joining us today for this week's Q&A. I have had Dr. Ceballos talk to me once before. Actually, we've talked twice before. One of them we didn't record. That was intentional. But I get so much from my conversations with Dr. Ceballos that I said, please, please, please come do this. And she agreed. So thank you so much and welcome.
Yes, I'm happy to be here, and I always look forward to having one more conversation with you, and I hope we continue this on.
You know what, we will. So Dr. Ceballos, you are the medical director of the Women's Division for Intermountain Healthcare. Can you just give me a general overview of what that involves in terms of the term Women's Division?
Yep. So when you're part of a medical, multi-specialty medical group, in other words, there's different specialties within Intermountain that you get a particular division because that's the service line that I get to help manage alongside a wonderful team. But I'm the medical director. So what that means is anything that has to do with the practice of medicine. So not the business side so much, because there's usually a rub there between medicine, the practice of medicine, and actually running a business. But I get to talk about those things that patients should get when they come to a women's division. What kinds of services should we be offering to women at all stages of their life, and making sure that we're actually providing that, making sure that we're accessible to Nevada, especially here in Southern Nevada, and where I am here at Mountain View, but really throughout the valley. So it means always looking forward as well. So where are the needs for women's services? And so besides the 5 clinics we have within Las Vegas, always really trying to keep an eye of where are we going, what does the community need, et cetera, et cetera. And this is part of that, right? If you guys need, if this Facebook group needs to know a little bit more about women's health, I'm happy to jump on the phone, whether you're my patient or not, just exposing women and bringing up the bar in women's healthcare.
You know, what's interesting is I don't think I have thought of it from this direction either. And that's why I'm now in my mind is totally reeling is I get that women have different health issues than men. I totally do understand that. But what I often forget is that we have many different health issues.
Yes.
Many.
Many.
And different. And so I see now, I'm beginning to see more and more and more why it is good to break it up and have like a women's division in dealing with specific health issues. But I'm not quite sure what word I want to put in there. How do you make that decision? Like, where do you suddenly have a committee that says, oh, wow, this is definitely becoming a woman's issue and we want to cover it? Or how do we go about that?
So let me say this, women's healthcare is part of primary care. So actually a woman could have her OBGYN as her primary care physician. So we're part of primary care. So we're part of primary care like peds, like your primary care physician. We're part of that group. So family medicine, et cetera. We're just the lane within primary care that focuses on women's healthcare. And we can think of the obvious things like obstetrics, right? Of course, you want to see an OBGYN for that. But it's also those other things, the regular annual exam. If you go to your primary care today, they may not feel comfortable doing your breast exam or your pap smear. But obviously that's where we live. That's where we feel very comfortable. And so for most women up until about the age of 45 or 50, we can be their primary care physician. Now, once we see something out of bounds, let's say hypertension, diabetes, that's where I'm going to look for the support from my primary care physician. So being part of a multi-specialty group, I love that because these are my friends, these are my colleagues, part of my own group that I get to refer them to. And I know the best, I know the nice people, I know the Spanish speakers, all of that, all those things I need to know, that it helps so much that I'm referring somebody within the same group.
Right. So actually, that was one of my questions because I noticed you had said it earlier in a multi-specialty group. So the upside of that is you have colleagues that you can rely on to be up on different types of care.
Yes. Yes. So oncology, right? Pediatrics, endocrinology. So if you have a thyroid issue, if you have diabetes, if you have polycystic ovarian syndrome, whatever the case may be, most likely I have somebody who I know personally who I'm going to refer you to. And that makes a big difference because I'm not going to pass off my patient to somebody who's not going to be an extension of how I am
Right.
and the responsibility I feel when I'm taking care of my patients.
So, and actually, so along those lines, let's say somebody now decides to go see Intermountain Healthcare as their primary care physician, and they don't feel good. I don't feel good. Now I do. I feel great. So let's back that up. They walk in and say, I don't feel good.
Yeah.
They go to their primary care physician. Will that primary care physician, in particular at Intermountain Health, say, hey, let's do a blood test. Let's do this test, that test. Take a look at it and then make a determination?
Usually once primary care is taking care of you, they're now, as your primary care physician, they're only going to refer you to me if you want to know about, let's say, contraception, if they don't feel, like they know enough. Hormone replacement therapy, very common. Urogynecology, I'm having some bladder issues. Any woman over 50, I can tell you it's really hard for her to sneeze and walk at the same time. She usually has to stop. So those particular women's issues, we're happy to help support our colleagues. But usually what happens is that somebody comes in for their pap smear or their prenatal care, and then they stay with me because they're like, oh wait, you can, like, know me, and
Right.
you can take care of me every year. I can just come see you. Yes, you can. And so usually that's how it goes. We meet them actually first. We meet them when they're
awesome.
young and healthy and pregnant and all those things. And we take them throughout the rest of the stages of their life.
So I'm going to ask maybe a question you don't know right off the top of your head, but you can estimate it for me. How many doctors do you think you have in the women's division?
Oh yeah, we have over 20. So we have different service lines within women's, right?
Oh, okay.
So we have midwives are part of women's health. We have what are called OB hospitalists. So remember back in the day, I can say back in the day now, I used to get up, I'm credentialed in 5 hospitals in Las Vegas, and I would get up any day, any night, any time and go deliver baby, including if I was sitting here in clinic seeing a patient and they said, Dr. Ceballos, you have a patient who's about to deliver. I would jump in my car and go to that hospital and deliver her. What we have now within obstetrics, and for quite a few years now, are what are called OB hospitalists. And they just do OB. They're on labor and delivery 24/7, and they do our deliveries now.
Oh,
so
perfect.
Yeah, so it keeps me in the clinic. It also keeps me in my bed at night. And it actually provides the balance that many younger and female physicians want as moms, right? First time I jumped out of the pool of my kid's swimming lesson, I'm like, I can't do this. I need to find some way. So I've been able, as a woman, as a physician, as somebody who needs balance in her life as much as is possible, really try to develop a women's division who caters to that. Mm-hmm. And really tries to give back to physicians balance in their lives as well, so that I am not trying to pour from an empty cup, but that I'm here able to give all that my patients need.
Yeah, which makes perfect sense.
Right.
So, well, then tell me, if you can, what is that pathway for a woman that comes in with a lump?
Yes. So a woman who comes in for a lump, one of the first few questions, you definitely want to get a great history. What's her own history, but also what's her family history? And then when did she find this lump? How long have you had this lump? And then depending on her age would actually help determine what types of imaging modalities I would use. The younger we are, the more dense our breasts are. And so what I would use to evaluate a 20 or 30-year-old is different than what I would use for a woman over the age of 40. And so do I start with the breast ultrasound because I know these breasts are more dense? Obviously, the size of the lump is important, the location. Does she have lumpy breasts? In other words, something on both sides? Is this unilateral? All of those details. Is there a discharge from her nipple? All of those details really add to what is my suspicion that this is a malignancy or that this might be something benign. So a thorough history that includes obviously age, parity, how many times she's been pregnant, kids, risk factors, family history, etc.
So you go deep, right? It's a lot of information.
Yeah. We're used to asking a lot of questions and a lot of personal questions.
Yeah, which I'm thankful for. That makes sense. So
Yeah.
that happens, and then all of a sudden, then yeah, let's say we have, I don't care. It doesn't matter her age, but you've managed to diagnose the fact that she does have a stage of breast cancer. Let's say an early stage of breast cancer. Would she then have to leave Intermountain Healthcare's health program, or does she stay with Intermountain?
She does have to at this point. And that's because we don't have breast specialists. So that's
Right.
a very particular area that deals with breast. But I can tell you, anybody in women's knows the exact person that they should send her patients to. I have my two tops, right, that I use. And most payers, I know that they can go to those two women.
Right.
But I want to send them to a woman. That's just me. Not everybody feels that they need to do that. But I send my
Yeah.
patients to other female providers. Most of us feel comfortable with that. Besides that, they're the best in town, and they're as wonderfully nice as I would want and expect them to be.
That's awesome. You know what I love, but I love that philosophy is, you know what, you're in it to help save lives, right? That's your goal, is to, one, I remembered it, and I also wrote it down. Healthy people live the healthiest life possible.
That's
and,
right.
Yeah, I committed it to memory, my friend.
Look at you.
You know why? I like it. I really like it. It makes sense to me. I can understand it. Anytime a tagline like totally applies to my life, I'm in. So I do appreciate that you take the time to refer people someplace where you actually, have experience and are like, this person is going to help you out. So, but they can still come back to you just if they're, they got a sore throat or.
I expect them to. And here's the other thing you tell them when you refer them. You're like, if you have any issues at all, me referring you, they know exactly why I'm referring them. I want to hear about any bumps in the road. This is your place that you come in and you check in and you let me know. Because like I said, I work with a wonderful staff who's willing to jump on the phone. We can make appointments for people. We do whatever needs to be done.
Wow.
So if somebody says, I'm not getting into the office. Okay. And I have a wonderful nurse that works with me that she makes magic happen. And so we help patients because this is not something you want to sit on, right? This is something that I need attention now. So my patients know when it comes to breast, I tell them all. So we teach breast awareness in the clinic. Right. And I tell them, if you have an issue, I don't care if you don't have an appointment, you walk in here, Dr. Ceballos will see you. This is top of the list. This is the number one thing we worry about in women's health is breast issues.
I don't know, have you found, I don't want to say false positives. That's not what I'm trying to say. But I kind of feel, and after the announcement today from Al Roker and his prostate cancer diagnosis, one of the things that he said was they caught it early, and early detection is going to save his life. That's what we say when it comes to breast health as well.
Yeah.
So I know how do you encourage women to not worry about what the doctor is going to say? I know you are going to be positive because we love you and you're fantastic. And everybody at Intermountain Healthcare, but not everybody gets to use Intermountain Healthcare at this moment. How do you encourage people to just be strong and go in?
Here's the thing. I put the responsibility on providers. We have to instill relationship, rapport, and trust in our patients. They have to have a good experience when they come and see us. And that means we have to talk. We can't walk in a room, do an exam, and walk out. We have to sit down. We have to talk about what is particular to their life. And you're doing that over the years, that when something does happen, they're like, oh, I'm going to see my girl, Dr. Ceballos, because I know she's got me. It's really, for me, my experience over the last 14 years of being an OBGYN, it's really been that. That's why I see a housekeeper and all of her colleagues that she works with. That's why I see her daughter, her sister, her mother. I see whole families because it really does start with that relationship. I get to help with graduate medical education, which means bringing up the next generation of OBGYN. And let me tell you, it starts with that relationship, not just with your team members, but with your patients. They have to trust you. that means you have to know what you're talking about and what you're
Yeah.
doing. And so those are all the parts of it. It starts with that, because just telling somebody, hey, trust your doctor, well, it doesn't work like that. Most prescriptions that are written by providers are not filled. About 35% are filled. And people aren't here. That means that's our problem. We're not doing things right, that people don't understand how important it was that I wrote this prescription for you.
Right.
So I'm going to own us back on providers and say it starts with us. So I don't know what, you know, I can tell somebody what to do. Hey, trust me. No, they just have to innately trust me, because they see that at every turn I'm doing everything that they need, and I've done that for years.
Yeah, I think that, or fortunately for you, that's natural. I talked to you once for 5 minutes, and I'm like, yes. What do you need from me? I will give it to you freely, because you are a genuine person. Well, yeah, you're a genuine person. You're genuine. And I, you don't see that a lot all the time in the medical profession. And it's no fault of the doc. I'm not blaming doctors. I can't imagine what it's like to become a doctor. It's a lot of schooling. It's a lot of stress. I mean, a lot goes into it. So that's not lost on me. But can you teach that aspect, do you think? I mean, I like that you teach that aspect. Do you think that you're getting through?
Yeah, you have to model the behavior. So I have to be that, and I have to be that consistently. When I was in residency, I went to residency at Harbor UCLA, which is LA County. And what was always amazing to me is that I had attendings, people who were teaching me, who would tell me to be nice to patients, but they weren't nice to me. And that never really made sense to me. And so it's so important for us to not only ask that of people, but to be that, in fact, at all times, as much as is possible. And I think that we can be that consistently. But here's the other thing I would say, and I tell my patients this: if your provider is not listening to you, if you feel like your provider is not listening to you and you don't trust you need a new provider.
Right.
You need a new provider.
Agreed.
And so we feel like we have to stick to this person, and this is the way it is in healthcare in Nevada. The only way we're going to change that is really make sure that we're going to people who we can trust and are consistently doing well. Yeah, I tell you, people will ask me, do you want to close your clinic? Do you want to max out your clinic? Do you want to close to new patients? No, 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 no. I just need to get more people who are going to help me do the good work I'm doing.
Right.
But it's not me. I know so many great physicians in Las Vegas, Nevada. We just have to keep looking for them. And I would tell patients, don't settle.
Right. I actually completely and totally agree with you. And I find that we do settle a lot of times, and that doesn't help your health. And if that's the most important thing, I mean, I don't have two-legged children. I have four-legged children.
Yeah.
But gosh golly, those cats mean something to me.
That's right.
And my health is important, because if I'm not healthy, then I'm not here to take care of them.
Yeah. Yeah.
If you got real kids, it's 1,000 times more important, right? So,
Right.
You know what? I think I have met a lot of people through this Q&A and through my job. And I will tell you, I have met mostly really fantastic people.
Yep.
They're our healthcare partners in Nevada originally, and everybody got to move over.
Yeah.
So one of the things I want to remind people, I'm not telling you to leave your doctor. That is not what I'm saying. What we are saying is, if you feel you're not being heard, right, or you are not comfortable, it is okay to make a decision to change what you're doing.
Yeah. And here's the other thing. There's a patient bill of rights. It is your right as a patient to ask questions.
Yeah.
Like, help your doctor be better, right?
Yeah.
So ask questions. You know how many patients I see that I say, oh, you had a hysterectomy in 1996. Why did you? Oh, my doctor said. No, I know, but why? They can't tell me why. They said. So, it's okay. And it's actually the expectation I have of patients. And I think this is a way we can check ourselves. Could this patient go home today and talk to their sister, their daughter, their mom about what I just told them? Because I said it in terms that they understood. And then I reset it, and then I asked them if they had questions, and then I answered those questions. And here's the thing. I see a lot of patients every day. This doesn't mean I'm seeing 10 patients a day because I talk so much. I have learned to be efficient and thoughtful and mindful. What we get to hone, the skills we get to hone is I know what questions, I've learned what questions are important to ask.
Right.
And I'm not afraid of opening up that can of worms. Sometimes we have to, especially when it comes to sexual dysfunction and all of those things. And as a woman, right, we have to talk about, who else is going to talk about that? Nobody.
Yeah.
So yeah, we have to be able to do that, but do it efficiently and thoughtfully. And don't try to shove everything into one visit. So
Right.
if your doctor doesn't have time that day because they're really busy, and that's possible, absolutely.
Right.
Say, hey, can I come back, in a month and we can follow up on this conversation? They're probably going to say yes, because
Yeah.
most of us went into this because we're trying to help people.
Yeah. I actually agree with you. Honestly, I think most of doctors do it because they want to help people.
Yep.
They want to help healthy people live the healthiest lives.
That's right. That is right.
I've got it. Well, and you know what, along those, let me ask you this question, because one, I'm a woman in my 50s. And I'm fully aware of my health limitations at this moment. And in the big scheme of things, I am a very healthy person. Thank heavens.
Yes.
But I have a little extra weight on me.
Yeah.
So in my mind, I'm like borderline diabetic, which I don't want to go over the border, right? I want to stay on this side of the border. But in the big scheme of things, sometimes I feel these aren't that important for my doctor. But who else am I going to talk to them about, right? I'm going to pick up the phone and I'm going to say, do you find that you aren't getting a lot of women that are like, hey, you know what? I don't want to have a heart attack. I'm heart attack age. So I don't want to have a heart attack. What can I do? Do you get a lot of patients coming in for that? Or is it only for, oh my gosh, I think I'm dying?
It's their annual exam. So it's actually not on them to tell us. We need to ask that question. Quick story. My mom went to see her. My mom's 74. She went to see her doctor. It was like 5 years ago. And I said, Mom, how was your appointment today? Fine me, huh? But I'm a little upset. Why? He didn't talk about my weight. She was a little overweight. He didn't talk to, if he's not going to talk to me about it, nobody's going to talk to me about it. And you know what? I said, that's right, because it is uncomfortable to bring that up.
Yeah.
But if not me, but because here's the thing. When I bring it up, I get it. When I finish breakfast, I'm thinking about what I'm gonna eat for lunch, right? I'm a woman. Girl, I'm right there with you.
Yeah.
I know. If it was up to, if this was easy, I'd be a size 6. I'm not.
Yeah.
Okay. So once you break it down like that, and you're talking just girl to girl, heart to heart, we laugh and we come up with a plan. And so you have to find out, it's all in the presentation, that is true, but you have to be able to get, as I would say, down and dirty like that with your, if not us, then who?
Yeah.
And this is somebody I'm going to take care of for the rest of her life. We don't sign off when you deliver your baby.
Right.
We're taking care of women throughout their lives. So how well she lives her healthiest life is a testament of my care. Mm-hmm. So I take that seriously. So yeah, we have to talk about all that. But most women won't bring up those issues. We have to bring it up.
Right. Fortunately, I don't want to have a heart attack. I don't. I'm fully
Nobody
convinced.
Does.
That's not, I'm like, so I was willing to bring it up. So much so I even said to my doctor, which is literally, I could technically walk to my doctor's office. I have walked past my doctor's office before, so I could totally walk to her office. And I've said, hey, periodically, I want to stop in. I don't want to make an appointment. I just want to stop in and get on the scale, because I've weighed myself on this scale. I know this scale is calibrated the same. Yeah. So, and she said yes. And you know what? I felt really good about that. I was like, okay.
I love that.
I'm like, I'm not going to make an appointment to do it. I'm literally just walk in with my mask. I will stand out of everybody's way, and I'm just going to get on the scale and leave. Yeah. So I do love that idea. I will tell you, as we might have been saying before I started recording, I'm not shy. I don't have a shy bone in my body. And sometimes I don't advocate for my own health. And if I'm not doing it, and like I said, I could talk to anybody about anything, that I imagine it's really hard for people that don't like to talk at all.
Yeah.
But it's important. It's your health, right? I mean, we are responsible for our own health.
Yeah. And here's the thing, if we're taking care of women over their lifetime, we don't have to hit it the first time I meet them.
Right.
We may just talk about that the next time they come in when they're like, okay, that wasn't so bad. You know, I'm going to come in next year. And you do get to those more difficult conversations. I will say this, I am very mindful of when we talk about things, what I ask about, what I talk about. And it does depend on how well I know the patient, because I want to make a difference. I don't want to just bring it up. I actually I want them to, you know, believe what I'm saying to them and actually think about. But it also means I have to know like what works and what doesn't work, right? Does Noom work? Have I logged into Noom and checked it out and gone through it? You know, Weight Watchers, Nutrisys, I too have to know, because that is a significant issue among women. So many of us care about those things.
Yeah. You've actually brought this up a couple of times in our conversation, and I want to touch on it because, again, I am the number one anti-culprit of an annual checkup.
Yeah.
Before, and in all fairness, I was uninsured for many years and I was underinsured for several years. Now I'm insured and I can afford to go to the doctor. So I've actually been going. But I'm going to bet what you're telling me is an annual checkup is really important. Is that what I'm hearing from you?
Absolutely. Absolutely. It doesn't matter how old you are. If you're 16, we're not doing any exams, but we're talking about things that are so important. And if they're not important at 16, they're about to become important at 18 or 19 or 20. We know that. So most of the time we're just talking. The other thing I tell my patients, because I'll see patients like, let's say I haven't seen them for 3 years and they say, oh, I didn't have, you know, insurance for the last 3 years. I said, you need to come in here and see what our cash pay offer is, because they, you know, we can still, not having insurance, even though it's difficult. And believe me, I can't come from very humble beginnings. But healthcare is the cornerstone of really our well-being. How healthy we are is so important to whether I can show up at work consistently, how I am at work, the fact that I'm not getting pregnant when I shouldn't and I don't want to, right? We should make all those decisions very decisively. And here's the other thing. When you come in, a big part of the annual exam is a breast exam, which big part of what you do, and pap smears. Cervical cancer in the world, number 3. In this country, it's number 30. Why? Because we take care of that and we talk about that. So there's so much importance. If we're doing our job, we're educating, sometimes even more than what we're doing to somebody. We're just talking about, hey, asking the pertinent questions for that stage in their life. So annual exam, super important. And on our side, so important to talk to a woman about where she is in particular in her life. So birth control at 18, very different than birth control at 28, very different than birth control at 38, 48, etc. So yeah, a lot of stuff to talk about.
Which is, you know what, and I think that's what we forget, right? I mean, we think it's you're in, you're out, and that's it. But I mean, a lot of things are going on in my body right now that I'm 50 something that weren't going on when I was 30 something, even my knees, right? I'm like, it's never ending. But it's quick to sit down and have a conversation. Look, here's 3 things I'm concerned about. Here's why I'm concerned about them. Conversation. And all of a sudden I'm like, oh, it's normal. Oh, it's normal.
Yes.
That we can't same time. Good to know, right? You know, it's just little things.
And bring questions to your visits. Bring questions. If somebody says, I don't have questions, I don't have time to answer any questions, say, okay, can I schedule an appointment in a month when we can, or in 2 weeks? And if they say no, you need a new provider.
Yeah, agreed. Which is the one thing the takeaway is, if you don't feel you're being heard and your health is not being addressed. And I've told this story before. My father passed away from colon cancer, and he had a 21 centimeter tumor in his colon because, and this was my dad's sentence was, his doctor was only paid to deal with his high blood pressure. That's what the insurance was paying for. That's why he kept going back. Never discussed the fact that he wasn't feeling well, that his stomach hurt. There was no investigation of that. I'm like, where would we be today if he had a conversation with his doctor about it. So
Yeah.
it was a very difficult lesson for me to learn, obviously.
Yes.
But
Yeah.
which is
Ve-
have a conversation.
Have a conversation. And here's the thing, if it's out of bounds for me, I know somebody, and we
Right.
all do, right? We all know somebody. So, oh, you know what? That's not something I can help you best with, but let me refer you to this person. Absolutely bring it up and let us help.
I think that's actually another thing I like about the umbrella of Intermountain Healthcare, along with other providers. I'm sure there's other providers that have multiple people under one roof, hence the multi
Specialty.
system. Yeah, multi-specialty system is, yeah, let's find someone. All right, yeah, this is a little different than what I normally deal with. That's the great thing about having it all under one umbrella for Intermountain.
Yes. And it's not maybe even as hard as it used to be, where we have electronic medical records. Literally, I have a referral tab, and under referral tab, it has every specialty. And I just click that.
Yeah.
And then magic happens. And when you check out, somebody gives a referral to whatever I referred you to. So it's not that hard for us to help with people that way. We do have to be listening, but somebody has to ask a question, right? Like, hey, this is happening. I'm getting headaches all the time. That isn't what I manage, but I know people. I know people who do. Yeah. So bring it up. If nothing else, bring it up. But that's why having a primary care physician in each of our lives is so important.
Right.
Because they really should be at the head of your healthcare, referring you out. Everything's coming back to the person who they referred you out to. That referral consultation comes back to your primary care, and now they have a global perspective of kind of all the things that are going on in your healthcare.
Exactly. Yeah. So different than when I was young.
Yeah.
And it was all in paper files. That's how old
Yeah. That's changed now. It really, people, the older physicians will tell you how many times they have to click, because we don't even think of that, right? We're used to clicking all day. But they'll tell you about how many times they had to click to refer someone. But it's such a great part of really how we get to use our platforms, our electronic medical records, and the platforms we use. And so much of Intermountain is connected that way here in Nevada, where if I write a referral, we can easily access that chart where it's right? Where all of the communication is happening within a group. Most of us know each other. So we're texting, hey, I saw your patient today. They're doing great. This is what I'm going to do. So we do a lot of that is happening behind the scenes as well.
Wow. It's so awesome. And
yes.
Again, it's awesome to be able to talk to you. I do enjoy it. I learned so much. And yeah, I'm like, you're gonna probably get a lot of calls. Can you really want to come see you?
I'll take it.
Exactly. So I do appreciate your time. I get that you are busy, so that's why I was like, I got to make sure I stick to my timeline here, because in my mind I probably could ask you 10 more questions, but it's all plus I have this rash on my hand. I'm totally kidding. But I get it. It's funny. I bet you do get that a lot, though, right? At parties, you're like, I'm a doctor.
Oh.
Ask you a question.
Let me tell you, it doesn't matter what I'm doing. I'm going to get my nails done tomorrow. Inevitably, somebody is going to say, what do you do? I guess I should start going to the same person. That way we just,
you don't have to worry about it anymore.
But I could be getting a drink at, somewhere, or, it inevitably comes up because I do say hi and I start talking, and they'll say, what do you do? And there's a question that comes right after that. But here's the thing. The easiest thing for me to be is an OBGYN. Like, I know, right? Like, ask me whatever you want. I know this. If you ask me something else, I don't know.
Like, I got an answer for that question. No problem. Money management? Stock investments? Don't know so much. Yeah.
But if you ask me about your menstrual cycle, I got you.
So when men meet you, are they like, oops, not asking, right?
No, everybody jumps on it.
Oh, I love it. Yeah, I love it. Well, again, thank you so much. I appreciate your time more than you know. And we will be seeing you like this again. I guarantee you, like
I hope
6 months. Yeah, 6 months from now, I'll be emailing saying, Dr. Ceballos, can we have a conversation? I do find that so many things change in medicine so quickly.
Yeah.
And plus, after COVID is over,
Yes,
there's
yes.
gonna be a whole other set of questions to ask, really, you
Yeah.
know what I mean? So I do appreciate your time. Again, thank you so much, and we will see you soon.
Okay, thank you very much.